health experts say you can take many preventative measures now to keep you healthy down the road. KRHD's Diamond Dixon had a chance to sit down with a clinical professor with Texas A&M Health on how colon cancer can be treated and often curable thanks to early detection.
But it's the third most commonly diagnosed cancer in both men and women in the United States, and is actually the second most common cause of cancer-related death in the United States.
Dr. McKnight with Texas A&M Health breaks down how colorectal cancer affects us.
Colorectal cancer typically develops as what we call a polyp. And so a polyp is a very small bit of abnormal tissue that's located somewhere in the colon or rectal area, and over time grows and becomes more abnormal and eventually can turn into cancer.
This tissue-forming process may take up to 10 years, emphasizing the importance of staying up to date with your cancer screenings.
Just because you have one colonoscopy and everything's clear doesn't mean you can't develop polyps later in life.
Being able to look at past screenings allows doctors to identify abnormal tissue early on. It can prevent a cancer diagnosis in the future. Joe Thomas is a cancer survivor. He shares with us how he was able to catch it before it was too late.
I was fortunate to be blessed that it wasn't too late. It was third stage with me. And I'm so glad that it showed me that it was going to deal with me if I didn't deal with it first.
Breast cancer is a disease that primarily affects women, and while it may not be as common in men, Thomas gets regularly screened for all types of cancers.
Cancer, anywhere it is, can be a bad problem. It can be a serious problem. In the colon, chest, wherever in your body. It is a devastating thing to deal with something that you can't handle without help.
Through the Texas A&M Family Residency Program and School of Public Health, you may qualify for free screenings.
A grant through CPRIT, which is the Cancer Prevention and Research Institute of Texas. And that grant pays for colorectal cancer screening for rural and underserved populations.
If you have questions about your colon health, Dr. McKnight recommends you reach out to your primary care physician on when may be a good time to get a colon screening. Reporting in Bryan, Diamond Dixon, KRHD News.
The American Cancer Society estimates the number of colorectal cancers in the United States for 2023 are just under 107,000 new cases of colon cancer and 46,000 new cases of rectal cancer. Dr. McKnight says for those in the Brazos Valley who do not have health insurance but still want to get medical attention, you can visit texascstep.org for more information.